Hello everyone, how are you today? I'm Dr. Paramjeet, consultant cardiologist in Yashoda Superspeciality Hospital, Delhi NCR, and you're watching Dr. Education. Welcome to my channel. I make videos on simplified medical explanation. So today's topic is DASH diet, dietary approach to stop hypertension. This video will tell you about the natural ways of controlling and curing high blood pressure problems. Not just high blood pressure. DASH diet is known to prevent and even reverse diabetes, decrease your risk of stroke, decrease your risk of heart attacks, coronary artery disease, peripheral vascular disease, obesity, and a lot of other diseases. This diet is recommended as the #1 diet amongst 40 other diets all over the world by the US national news and even by many US dietary authorities. So the good thing about this diet is that it's very easy to follow and it's very flexible. The only thing you have to remember are some rules. So before we start explaining about you this diet, please take a minute. If you are new to this channel, then before going any further, press the subscribe button on the channel and click the bell icon besides the subscribe button so that you are notified about my videos as soon as I come online. So guys, let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Dietary approach to stop hypertension starts with the most important step. The first step is to increase, and by increase I mean as much as you can. Increase your vegetables, your salads, your fruits, your low-fat dairy and lean protein intake. So you have to increase vegetables and fruits as much as you can. Eat them whole day as many times as you can, and then eat low-fat dairy products. By low-fat it means toned or double toned or skim milk and products which are made from them. Then lean meat, lean protein. I'm going to make a video separately on lean protein. What is lean protein? There is a lot of myth and a lot of confusion about this topic as well. So in the next few days, lean protein video is also coming up. So first step of DASH diet is to increase your vegetable intake, your salad intake and your fruits intake as much as you can, and increase your low-fat dairy and lean protein intake. So that's the first rule. According to this rule, whenever you see a fruit, a vegetable, you eat it. Try to eat it. That's the best approach. And whenever you have a chance, take low-fat dairy products twice or thrice a day, and of course lean proteins. So what do you need to avoid? What do you need to decrease? You need to decrease 4 things. The first and most important is salt, sodium chloride, sodium salts. So any kind of common salt, rock salt or any sodium salt needs to be avoided. Yes, rock salt is mostly sodium salt and it has added minerals. So you can take potassium salts, black salt, what we call in India as senda namak, kala namak. So that has potassium salt, that can be taken. So you have to decrease your salt intake. Decrease, not stop. Sodium is required. You don't have to stop taking sodium. That's also wrong and that will harm you. So normally in an adult, 2300 milligrams of sodium can be taken. And if you want to go on a low sodium diet, you can go till 1600 milligrams of sodium per day. So that is recommended. The second thing which you need to cut down as much as you can are sugars. The sugars are all the simple sugars, simple carbohydrates. Anything which tastes too sweet on your tongue needs to be avoided. Now, there is a disclaimer here. If there are certain fruits which taste very sweet, which shouldn't be so sweet, so that fruit might be adulterated with sweetening serums. So you need to avoid that as well. Other fruits which are normal or less sweet, you can eat as much as you can, as much as you want. So you have to decrease sodium, you have to decrease sweets, sugars, any kinds of sugar derivatives, any kinds of biscuits, any kinds of rusk or baked products which have added sugar. So you have to avoid sugars. Third thing which you need to decrease and avoid as much as you can is alcohol. Yes, alcohol does harm you in a lot of ways. I'm going to make a separate video on that, but for now, for this video, you have to understand that you have to limit your alcohol intake as low as you can, if possible 0, and if need be, you can take once a week 30 or 60 ml maximum. So the third thing which you need to avoid is alcohol. And the fourth thing which you need to avoid are red meat. We'll make a separate video on red meat, but for now you need to understand that you need to take less amount of red meat, alcohol, sugars and salt. Now, one more thing which you need to avoid are processed food. Any kind of processed food has either high salt or high sugars or high saturated fats or very high preservatives. So processed food is also to be avoided in this kind of diet to be healthy. So till now we have seen two things. First, we increased your vegetables, your fruits, your low fat dairy intake and your lean meat, lean protein intake. All these things which we increased are very good, very high in calcium, very high in potassium and high in magnesium. So this diet is basically high potassium, high magnesium, high calcium. Then we decreased your sugar intake, your salt intake, your alcohol intake and your red meat intake and processed food intake. All these things are bad for you in a high amount. It's very less can be taken in a moderate to low amount. Then what needs to be taken in normal amount? In a normal amount, you can take whole grains. Whole grains can be taken in a normal amount. That means anything which is made of whole grains. By whole grains, I mean not food grains, not processed, not refined grains. Whole grains. That means brown rice better than white rice. Brown bread is better than white bread. So take brown bread. Take brown rice. So those things can be done. Then what else you should include in your diet? Fish. At least 250 grams of fish per week should be taken, because fish are very high in omega-3 fatty acids and a lot of important essential minerals, vitamins which are needed for your body. So you should take fish 250 grams or 8 ounces of fish per week, or you can take any kind of seafood instead of fish, or you can, if you're vegetarian, you can go for a substitute fish oils or omega-3 capsules. Poultry eggs needs to be taken. In vegetarian options, beans, seeds, nuts and vegetable oils. All these things need to be taken in a moderate or normal amount. In India, usually our diet includes 80 to 90% of carbohydrates. We are inclined to eat a lot of rotis, a lot of chapatis, and these chapatis are 80 to 90% carbohydrates. So we are very high carbohydrate eating people. So in India, I'll recommend to decrease your rotis, chapatis to half and add vegetables, add salads, add fruits, add milk, low fat milk into it, add protein into it. So that makes a dietary approach to stopping hypertension. So if you do this diet, you will have a lot of good benefits. Your blood pressure will start becoming normal, or if it is normal, it will not rise. Obviously, it will not decrease below the normal level if you are eating a normal amount of salt. So that's why a normal amount of salt is needed. Then if you do this diet, your cholesterol will start to decrease, your blood sugar will become normal, your sugar management, sugar resistant insulin level will get repaired, and then your risk of developing heart diseases, coronary artery diseases, stroke, and even kidney stone, risk of kidney stone also decreases. So a lot of good benefits are coming from this diet. And if you think about staying healthy or living a longer life, healthier life, this is the diet to do for a long time. And the best thing about it, it's very easy, it's very flexible, and this has zero side effects. You will not have any side effects from this diet. You can continue this diet as long as you can for all of your life. So make sure you share this video to every single person you care about so that they know about this diet and they can thank you forever. So guys, if you have any queries, any questions, feel free to ask me, comment on this video, do like and share this video. I'm Dr. Paramjeet. There are a lot of more videos on my channel about weight loss diet. I'm going to start a few sections on weight gain as well. So guys, I hope you liked the video, and if you did, then don't forget to like and subscribe my channel, and don't forget to share this video on your social media platforms. These kind of videos needs to be shared, needs your support. I need your support. I'm Dr. Paramjeet. Till next time, stay healthy.